You're listening to State of Vape in Canada with your hosts, John and Christina. This show was recorded Tuesday, March 7, 2017. Enjoy!
Today's podcast is going to be on the history of harm reduction in Canada. And the reason why John and I decided to dedicate this podcast to that particular topic is because there's a lot of talk, obviously, about harm reduction in the vape community. It's, you know, the main focus of the work that a lot of vape advocates do, like the idea that vaping is a less harmful alternative to tobacco. But sadly, although people do discuss harm reduction a lot, they're kind of lacking in the broader history of the harm reduction movement in Canada, in North America more generally, and throughout the world. And so we wanted to inject some of that information within the vape community. We want to let people know what the roots of harm reduction are in other movements, grassroots movements most of the time, and why. Today we have a guest, Garth Mullins, who's going to be with us today to talk about a particular grassroots harm reduction movement in Canada. Garth?
Hey, Chris.
How's it going?
Good.
Do you want to quickly introduce yourself to our listeners?
Sure. I live in Vancouver here in the Coast Salish Territories in BC. I've been a harm reduction activist and a community organizer for a long time, and I'm a broadcaster, writer, and a musician.
Awesome. So a lot of talents in one person.
I try.
And we invited you to the show today because I know, like, from our mutual, like, kind of activist history, that you've been involved in a lot of harm reduction initiatives out in Vancouver, specifically around drug use. So I was wondering if you could enlighten us a little bit about the history of harm reduction broadly, and then specifically with the struggles that you've been involved with.
Sure. Right now, I'm just talking to you from the edge of the downtown east side in Vancouver, which is kind of the epicenter of the overdose death epidemic that's happening. So last year in BC, almost 1,000 people died from drug overdoses, which is a huge, massive increase in numbers over years past and other jurisdictions. Per 100,000, we're just ahead of anywhere. And if you don't know about fentanyl and carfentanil, these are very powerful opiates that are getting into the drug supply. You will soon, because it's coming to a community near you, and certainly folks in Montreal will be all too aware of this. Mm-hmm. So the harm reduction, the idea is you don't solve the whole problem. It's not an entire revolution. It's trying to replace something that's causing incredible harm to the individual and to the community with something that is less harmful. So it's not entire harm elimination. It's trying to treat the most severe symptoms right away. And it really is, it's an emergency response. And that's where it came from. And in Canada and in Vancouver, harm reduction came out of the overdose epidemic last time. And I was there last time as well. It was in the late 90s, early 2000s. And we were seeing, mid 90s in some cases, we were seeing a person die every day from a heroin overdose when particularly strong heroin came into the drug supply in Vancouver.
Right.
And this was, to put that in perspective, now someone's dying every 6 hours. So it's quite a bit worse now than it was then. And this is sort of where organizations of drug users, methadone patients, peers, and activists kind of came from, was through the response to this emergency. And this is where the idea of safe injection sites came from in North America, Insight being the most famous. And that was started by activists who not only did they lobby leaders and officials, but they just went out and started their own unsanctioned, unapproved, illegal safe injection site. And this is a place where people can use intravenous drugs under medical supervision so that if somebody overdoses, there's help really close at hand. People can jump in and save them. And that has happened thousands of times. It's not a place where drugs are given out. It's not a place where you can go and get heroin. inside looks very medical, very sterile. It's not a, party HQ or anything like that.
Right.
So this came from people starting up their own, and very quickly government was embarrassed into funding a pilot project, which is Insight. Never meant to be the total solution, never even meant to be the total answer for safe injection or supervised injection site, just a pilot. So right now there's sometimes a half-hour lineup. That started in the last overdose crisis. In this one, people put pop-up tents as safe injection sites in back alleys because people were overdosing in back alleys and places where they were using drugs. There's also a housing crisis in Vancouver, so it's making a lot of people very marginally housed or homeless. And again, the government was embarrassed into allowing a bunch more of those. The time in between these two crises, most of it was wasted by the Stephen Harper government, who basically had a just say no policy.
Right.
So a lot of time was spent in Supreme Court, raising money to go to Supreme Court, these sort of things to defend the supervised injection site, but also to try and build out another harm reduction approach, which is called heroin-assisted treatment. Right now, if you are addicted to opiates, and a lot of people are, not just heroin, but prescription opiates you've gotten from the doctor, oxycodone, Vicodin, Percocet, these sort of things, there's really not too much in the way of solutions. You can go dry out at a detox house, which most of them are sort of run by private individuals in a pretty slipshod and unregulated fashion. Mm-hmm. And that's not very effective. In fact, people emerge from those. Certainly they've gone through detox and they've been dope sick and it's been a miserable 3 weeks or something or whatever. And they come out and they're very likely to use again, but their tolerance is completely different. So you get a lot of people that die right after they've tried to quit. Mm-hmm. So I always tell people, my God, be careful doing that sort of thing. So the second sort of treatment that's been mostly available has been methadone, and this has been around for decades, and it's opiate substitution therapy. It's a type of harm reduction. It's almost like a nicotine patch. It's that you replace the opiate that you get on the street, like heroin or whatever, with something that comes from a pharmacy, which is something you drink. It doesn't make you high. It doesn't let you get sick. It just gives you this kind of even keel. And, people can slowly taper off of that and get their lives stabilized. And it's a pretty successful program. But there's a lot of people, maybe 15%, for whom something like methadone or its recent sibling Suboxone won't really work. They're really entrenched, and it doesn't take. It's not for everybody. You need other options. And so what they have is heroin-assisted treatment. And that's where you get supervised pharmaceutical-grade heroin, because heroin was originally a pharmaceutical made by Bayer.
That's right.
The same people as made aspirin. So you get this injected into patients under clinical supervision twice or 3 times a day in a setting where they get access to health programming and other services. And that stabilizes them or gives people a chance to wean off. So there's a lot of critics that say, well, that's just giving drugs to drug users. And indeed it is. But right now, the illegal drug market is killing people. This is a way to keep people alive. And if it was rolled out broadly, then you would actually undermine the illegal drug market. You would make it a less profitable place to go. It could even dry up and disappear. But unfortunately, we have about 130 people that are on this program after fighting to be on it in court. And they were part of a test, a study out here, which found this method so successful that medical folks deemed it really unethical to then cut people off when the study was done. That did happen in a previous study group, and it just threw people into chaos. So, in court battles with the Harper government, they managed to at least keep getting the medication that was clearly working for them. The problem is we're having a sort of a stalemate with the provincial government and other authorities about whether to roll this out more broadly. So the Minister of Health of British Columbia, Terry Lake, for example, he says, well, we got to bring everybody along for something like this, by which he means other voters, conservative voters, people who don't like it.
Right.
So that's basically the sort of some of the high points of harm reduction. But nothing like this is granted by medical authorities or by government. It's always the result of the organization of drug users and supporters. So some of the most marginalized people in society have formed organizations and lobbied severely. Like last Friday, we had a meeting with Trudeau when he was here in the downtown east side. And that's part of the work, is going and talking to the top politicians. Now, nothing came of that, but that doesn't mean that something won't. But you try to work on all the different fronts, the courts, lobbying the politicians, and certainly in the streets. So on February the 21st of this year, in 7 different cities, we had a sort of a mass national day of action on overdoses, where we were calling on all levels of government to immediately implement these harm reduction approaches, because they have been now known since the last big overdose crisis, and we just can't keep waiting.
Mm-hmm. So one of the issues, because obviously, just to contextualize the discussion a bit, as I said in the introduction, our show is all about vaping as a harm reduction tool, and so I'm making this, or my brother and I are making this discussion happen because we want to be able to see the tools, the tactics, the challenges, the obstacles that others have had in other harm reduction movements, and see what applies and what doesn't apply to a movement for harm reduction with regards to vaping and tobacco. So I'm finding this amazingly interesting. So one of the things I want to know, and that you touched upon briefly, was who are the people organizing? And you said this is coming from the grassroots.
Yes, that's right. Yeah.
Well, so we're talking about people who are themselves IV drug users. We're talking about, what else? Are we talking about academics, scientists, researchers?
Certainly, we formed coalitions with those people. So there are service providers that are, over the years, you figure out who's your ally, and you work to build coalitions with them. And right now, this current emergency has actually really made it difficult to pursue the agenda, because our organizations are losing people quickly, including in the leadership, like the sort of the elected board positions. People are overdosing and dying in those positions too. Right. And then all the rest, we're involved in sort of full-time first responder activities, just injecting naloxone into people, which is an overdose reversing product that you can give to people who you find in an overdose situation, potentially save their life. It's part of sort of first aid which is available
free of charge at any pharmacy throughout the country.
It's not free of charge. You'll pay, between $30 and $50 for the stuff you need to make a kit at a pharmacy. The change, at least out here, has been that it doesn't require a prescription anymore.
Oh,
the Center for Disease Controls are putting out kits for drug users and people who are, in the immediate sort of family and friends of drug users, or people who are likely to observe an overdose. And I don't know how they quantify that. But
so the paramedics,
you can't just go into a drug
or something like that. Yeah.
Yeah. And I mean, the cops in Vancouver, I've been on them to, well, why aren't you guys carrying it? And I think they're just starting now. Mm-hmm. But certainly I think that's a reasonable demand, is that anybody should be able to walk into any pharmacy and get these things for free.
Yeah,
it should be part of every first aid kit.
I'm going to double check, because I think in Ontario and Quebec, they are available for free at any pharmacy, as long as you have a health card.
Yeah, I mean, that's great. It should be here too. It's amazing. Actually, when you were asking that question about, what are the parallel challenges to the vaping community? It's really bad ideas and stigma and ideology is what is one of the worst opponents. Is the world is just so full of conservative ideas about drugs and drug use, and the war on drugs still casts a large shadow over this whole situation. Like, for example, the police are still arresting people for possession of drugs, of hard drugs. And we should be standing stuff like that down. Those resources, which it actually takes a lot of resources to arrest someone, incarcerate them, put them through the court system, all those resources need to be rechanneled. And I mean, this goes to the further question of, what is the role of the law on drugs? And we have the example of Portugal, where they did decriminalize simple possession and drug use. So there's no one in jail for using or holding drugs in Portugal anymore. And, people can get access to treatment. They've also expanded health programs there. So there's other models for sure.
I guess one of the other things that you talked about was tactics or means, strategies. So you're talking about the day of action that happened in February. You were talking about legal challenges. Do you want to expand on those a little bit? The different types of tools that people have used to press the cause forward?
Yeah, I think that if you look at it, there's a whole spectrum of from lobbying politicians and meeting with them. Coalition building is super important. So just doing the community organizing the most affected people and finding the right kind of allies that are in the, academic or service provider sort of field. And also being willing to do the civil disobedience. So to break the law where necessary, to make services available that will save people's lives. And I think you try to box in the decision makers in the state so that certain policy alternatives become obvious and you can't turn away from them anymore. I mean, that happened with safe injection sites. People talk now from all levels of government that harm reduction is the baseline. They're all for evidence-based policy. They're all for harm reduction. They say that all the time. The downtown east side is always full of different politicians and ministers having photo ops at different locations.
Right.
So everyone's trying to signal their support. But then when it comes to actual funding and allowing for certain services, as I was saying earlier, particularly about heroin-assisted treatment, then that's a different case. So now we have the challenge of getting them to put the money where their mouth is, as opposed to before, where we just had a solid wall of opposition from the likes of Harper.
So there's been a lot of progress, in other words, in terms of getting that language, the language of harm reduction, become accepted and even clearly the default language when we're talking about these kinds of public health issues. If we compare to how things were, for instance, 15, 20 years ago.
For sure. And I mean, we do have a consensus that's come here on the health community too. Like the coroner is calling for this sort of stuff, finding that the morgues are full. The public health officials, the provincial health officer, people are calling for these kind of reforms because it's so obvious. And the sound of sirens is constant in East Vancouver now. It's crazy. If you listen to the scanner, it's just overdose. And every politician recognizes they at least need to be seen to be doing something, if not actually doing something. And so the challenge is to get this stuff actually implemented. We have a provincial election coming up here in May, and part of our challenge is trying to make it a real election issue that every party has to face.
So what would be the reason that, given the research, the evidence, the fact that the medical community is more or less on side and stuff like that, what would explain the reticence by politicians from moving beyond just lip service towards harm reduction and actually making a priority in terms of budgets, in terms of policy, etc.?
Well, I mean, because I think they're worried about losing votes. There's still quite a big conservative segment of the country on this stuff that just believes that harm reduction is wrong, that abstinence is the only way, that by prescribing people opiate substitution therapies, you're just enabling drug use. Basically, just last week, I think there was quite a right-wing editorial in the National Post, and you can find them all the time, of people who say it just enables things. And so, yes, that's true that harm reduction is a partial solution, right? It's what you do in the emergency. If the house is on fire, you get some water. But ideally, let's not be throwing gasoline on things. Let's build houses with sprinkler systems and fire suppression, and not build them out of tinder dry balsa wood or something like that.
Right.
And that part of the situation here means that we have to start looking at what is what is the driver of addiction to begin with? Certainly the other social supports like housing, like real lower barrier medical supports have to be there. And fundamentally, we're organizing this kind of society that is so alienating that it has created drug addiction as a persistent social problem. And if you look at societies throughout history, it just wasn't like this. That you have a kind of level of alienation in the hyper free market capitalism and community breakdown and constant assaults on community by, like gentrification or deindustrialization or lack of jobs or whatever. There's just always tearing at the social fabric that would help people feel whole, because we're not meant to just live as lone, isolated individuals. And the last thing is that trauma is a big indicator of likelihood to suffer addiction in your life. And so we got to start addressing those things too that have traumatized people. And, policies like the 60s scoop, for example, the residential schools have just sent ripples of trauma through generations. And, we've had a Truth and Reconciliation Commission, but we still have to get to the truth part and to the reconciliation part. So these sort of more fundamental questions are part of the solution. But the people who speak out about harm reduction don't want to see that kind of, more fundamental social change.
Oh, yeah, because then you're tinkering with the actual structure.
Yeah, and they're more likely to be aligned with sort of just let the market decide everything sort of solution. And I mean, the rule of the market over everything else, the supremacy of those forces it's just going to give rise to the sort of higher levels of alienation that eventually people will treat with addiction or substances in some way.
Right. I mean, the same dynamics are fundamentally true when it comes to tobacco, although the danger to people's health is not quite as immediate, obviously. But it's nonetheless there. I mean, we're talking about half of the people who regularly consume tobacco die from consuming tobacco. But yeah, it's not quite in the same stark situation as it would be for people who are faced with fentanyl on the street, for instance.
Well, that's right. I mean, it's not endemic to the opiate molecule itself that it's going to kill people. It's more bad drug policy that kills people than bad drugs. But I see the parallel to tobacco for sure.
Yeah. And so what gains have been made? I mean, we all know about Insight. Or maybe people don't. You gave a brief kind of sketch of what Insight is like a supervised injection clinic where people can go in a very sterile environment and inject their drugs with people on hand who would be there to help them should there be an overdose or something along the lines of that. But what else? What other gains have there been in the past 15 years on this front?
Well, so these heroin-assisted treatment study trials have resulted in a place called Crosstown Clinic, where there are 130 people that get this kind of treatment. They go there and they get pharmaceutical-grade heroin injected into them, in this clinical setting. And it's meant that they don't have to, do crimes and be grinding away to get their fix every day. It's meant that they've been able to reestablish connections with family and community and get access to health programs and, for the most part, stay out of the criminal justice system. So it's meant a change in people's lives. And of course, that is really good for them, for the community, and even for taxpayers in other parts of the province or country who now don't have to, pay for all that court time and ambulance calls and this and that,
And so, prison, et cetera, et cetera.
That's right. So on a number of fronts, that's good. The problem is we're kind of stuck at this number of 130 right now. And that program needs to be rolled out to people. Anyone who's, really in that vulnerable spot for an overdose needs to have more options than just, here's methadone. A lot of people who are really entrenched have failed out on that. And if you want to just go into treatment, there isn't just, a bed open for you anywhere. That's quite a process of waiting lists and kind of jockeying around to find a place.
Right.
So the things that exist right now need to actually be rolled out, and barriers lowered, and if people are in that kind of situation, they need to be able to get access to that. So, I mean, that the existence of these things has been won over the last 15 years. So Insight as a pilot project is now more secure. The Liberals are replacing the Tories' Bill C2, which made safe injection sites all but impossible. So for quite a while, we had this Respective Communities Act, which, put a lot of barriers in the way of opening safe injection sites. And there are cities across the country who are now in the process of doing that, who've been
Montreal's
waiting for years.
Montreal's going to be opening up its first one pretty soon.
Well, yeah, that's a perfect example, right? Like there's places where you really have the opportunity to save people's lives. And that's what happens there. When people overdose, there are trained medical people with naloxone or Narcan, the stuff I was talking about earlier, that you can use to reverse the effects, as well as oxygen and CPR training and that stuff. And so people don't die there. And over the years, they've probably saved hundreds or even thousands of people from that sort of situation. And so, but there's not just meant to be one. That's meant to be something that people can access kind of in whatever space that they're traditionally using drugs. If you look at the statistics from our coroner here, most people who've died from an overdose are found alone in a room.
That's right.
And they're found in communities all over BC, not just in the downtown east side. And they're often found on a weekend. So it shows that this is something that's not just affecting like a very entrenched, addicted population, but weekend warriors and, people in work camps for, resource projects or whatever, and people who are, in the more affluent part of the city. So it's all pretty expensive now in Vancouver, who are found using. So, yeah, it's sort of rippling out. And I suspect that as it becomes a public health problem, it's not just for a marginalized group of people, but is affecting more parts of society. And this wave of overdose deaths is going to spread to different parts of the country too. I'm sure that if you look at the figures in Ontario and Quebec, they're probably creeping up too.
Oh yeah, it's already started.
Yeah, and so as that happens, the pressure will increase. It's like a terrible kind of calculus to think how many deaths does it take before the people who are holding the purse strings act like it's an emergency and just roll the stuff out fast.
Right.
And we found that, there was an overdose emergency here declared in April of last year. I first started noticing it actually 2 years ago. Maybe it was in 2014. And that's when I got naloxone training myself. And the authorities here finally allowed people to operate what they call overdose prevention sites in November. Mm-hmm. So that's basically sites that are basically supervised injection sites, but are called something different. So it gets around that old Harper law that's still on the books. And those were won because people just didn't wait for permission. They started setting up little tents and little sites and doing these places without permission. So the government was kind of BC was kind of embarrassed, just saying, okay, just do it, just let it happen.
Of course.
And funding it. Yeah. So it's the place where the Vancouver Area Network of Drug Users is an organization of several thousand drug user members, and has groups like West Coast Aboriginal Harm Reduction Society and the BC Association of People on Methadone, various kind of harm reduction advocacy groups or activist groups. And they have a space where people meet and organize. And in the back of that space is one of these overdose prevention sites, like supervised injection sites kind of thing. Mm-hmm. And that was, these are the kinds of things that were started before they were legal. And so it seems like almost every step requires quite a bit of pressure. And that pressure comes in that kind of civil disobedience, but it also seems to come in bodies.
Yeah. Yeah. Well, I mean, for me, it just brings me back to what you said at the beginning of the show, which was that none of us should ever sit here expecting the politicians to suddenly become enlightened and advocate for harm reduction on their own. That none of these things will ever be given without public pressure, concerted, organized pressure being put upon them to push them into a position where they've got no other choice but to adopt a harm reduction kind of perspective.
Yeah, I think that's almost true of every progressive move. Like you think about, I guess tomorrow's International Women's Day, think about votes for women, all of that, like everything, social programs that all came through some kind of struggle.
And how has Health Canada been on this issue? Like, have they been like supportive? Were they resistant? What was their take on all this?
Well, I think Health Canada and Minister Philpott have been definitely more supportive than their conservative Harper predecessors. So they have made it legal for people to access prescription heroin treatment. But that has not been rolled out yet. Before, it was just not legal. So before, it was banned. So that's a good step in the right direction. The province now has to just make that service available, as I was saying before. And they're also moving to get rid of and replace Harper's old Respect for Communities Act. It was called Bill C2, that made safe injection sites really almost impossible to open, and replace it with something called Bill C27, I think, which is the idea of which is to take such issues out of this kind of criminal law area, and put them into health. So that's still coming. I personally wish that this was happening faster. And I think that, if we're going to say, for example, if they're going to legalize marijuana, right, which is a Trudeau campaign promise that they're working on, that if they tax that, they should redirect the taxes into harm reduction. And the feds could play a big role in building out pilot projects, like the federal government originally co-funded Insight. And, they traditionally have helped sort of co-fund projects and initiatives that are a little new or a little edgy, and they could do that here.
Were there any other points, John, that you wanted to add into this discussion?
I actually wanted to just take the time to point out the parallels between harm reduction groups that you say came together to address the overdose problems, and to the smokers who switched to vaping and themselves saw enormous health benefits and began joining forces as well to make sure government, whether it be provincially or federally, started adopting a less conservative approach to the way they were managing the harm reduction initiatives that they've put in years past. And that approach they wanted to include vaping, as they saw, the health benefits immediately. And one of the challenges that we've been having in changing those opinions and ideologies is the fact that there's a lot of studies funded by tobacco, by pharma, and different interest groups that paint a negative image on vaping, while at the same time you have reputable sources, scientists and doctors pointing out how it's much healthier and must be included in the harm reduction initiatives that governments put in place. Have you seen similar type of situations in the field that you've been working in, Garth? I
mean, I've definitely got into like dueling studies with ministers before. And it's not a place I enjoy being. It also reminds me of the climate change debate a little bit. Like, sure, you can find like studies that say climate change is a hoax or a myth or whatever, but they're mostly from the oil industry, and they represent a tiny minority of the academic work that's actually out there. Mm-hmm. Like, by far and away, people are showing that harm reduction works. Where you get the slippage is people say, well, harm reduction doesn't get people to be immediately abstinent from drugs. And then you can show studies that say, look, this person has been on such and such harm reduction program for a year and they're still not clean. But that's not the goal, right? So, and that's where you get to the ideological part, the buried assumptions in a study. And that's where we have this common problem that addiction is thought of as this kind of still thought of as this moral failing. Yes. Or this personal struggle that if you just had enough optimism and willpower, you could overcome it. And, maybe some people can, but a lot of people can't. And right. So you need more options. And addiction isn't just a binary thing. It's on or it's off. There's levels of it and dynamics to it. And so you need options. Yeah, you need the nicotine patch, but you need other stuff.
Right.
You know, and I think that's what you guys are talking about. And that's the same thing I'm talking about. You need all of these options. And,
yeah. Why throw away all the tools in our kit when they're perfectly fine and can do the work?
Yeah, absolutely. I mean, it's, I think, and a lot of government policy has carried this idea of addiction being this moral failing along for a long time. And they're just getting to it now as a result of the overdose crisis that's coming out of here. But if you think about tobacco, there's been a huge death toll on tobacco from the beginning. And that's, you know, I should say on the non-traditional use of tobacco, like non-Indigenous traditional use. And
yes,
that I think that's like trying to show that element more, you know, that people are saying, measuring in terms of, oh, well, you're not clean, like you're not off of nicotine or off of opiates or whatever. When in fact it should be, well, you're still alive, you know,
yes.
like that's the terrible kind of metric that we've now got to as a result of the drug war. And I think the same logic can probably apply to your guys' project.
I actually want to ask you, Garth, out of, you know, lobbying or, you know, sending emails to your politicians or senators or whoever in government that is involved in a certain project, what actions do you think are the most useful? Or is it just, you know, taking it from all angles and trying everything and hoping something works? What do you think is the best approach?
John, if I knew that, we'd live in a different world. You know, I like, how do we change things? I don't know. It's messy. It takes a long time. It's not linear. And it's just, I feel like we're all sort of in a tradition of struggle that goes back generations.
Right.
And right now we're kind of at a crisis point, certainly in terms of the overdose crisis, but also in terms of just progressive politics in general around the world, as you see the far right rising up more and more with these just sort of backlash, bigoted politics. And that don't kid yourself. That's going to affect your struggle a lot too, because when people just have simple moralistic solutions imposed by an authoritarian state, that's never going to work out well for people who have sort of like a nuanced harm reduction approach, like try and give people a little more agency, you know, that sort of thing. So I always look for links, and maybe this is the one thing I know, is that solidarity is the strongest tactic. So I feel like part of my role is to try and coalition build, to try and see the trade unions that have organized, you know, firefighters or frontline workers as part of the you know, the ingredients here to make a stronger coalition. That you eventually try and make a coalition that's big enough and broad enough that it raises the political costs on government of doing nothing.
That's right.
So if they want to just stay in the status quo, they will pay for it, because right now they think, oh, if we allow, you know, heroin assisted treatment, now we could lose some votes from the, you know, the whoever right-wing rural somebody somewhere, you know. And so we have to, at the same time, you know, try to educate those folks to change that position, but also raise the cost of the politicians for not doing anything.
Yeah, and the other takeaway that from what you've been saying, Garth, for me is the importance of having actual people from the grassroots of the particular issue that we're talking about organize for themselves. So,
yeah, it's a constant slogan at the among the groups: the "nothing about us without us."
Exactly.
Which means, yeah, well, it's obvious what it means.
It means what it means, right? And
yeah.
So for us here, at least from the perspective of my brother and I, and what we've been seeing over the past like year and a half, 2 years, is that the organizing that is happening among people who are in the industry. And granted, I don't hesitate to say that like 99% of the people in the industry are people who have quit smoking through vaping. So in a sense, it is being organized by the grassroots, but in another sense, people who are just simple consumers, people who are like just who aren't financially invested in the industry, haven't been organizing, at least not in Quebec, somewhat in other provinces to greater or lesser degrees. And I think that that's something that's lacking right now, is having an actual grassroots movement of vapors who've quit smoking through vaping, who'd want to like press their point home with government.
Yeah, I think industry has a role too. You know, you can even say, look, if you made this a prescription item, we'd take a per unit reduction. You know, right. Or I'm sure you'd make it up in volume, but you know, it's like you can at least signal your intentions that way. But I think the principle of like movements for change should be really led by the people who are most affected. Not on behalf of them by somebody else, because people get it wrong. Even with the best intentions, there's always, these weird unintended negative outcomes.
Right.
And we've seen that as with, doctors and things like that, deciding what to do about addiction on behalf of people who are living with that situation for way too long, and have gotten all kinds of strange outcomes over the years.
Have you ever had to deal with within your own community of people, like-minded people who are, trying to push the harm reduction initiatives? Have you ever had people within the community with diverging opinions at odds of the solutions, and not just with the government, but within your own community? And how would you deal with that if you did see some of those situations?
Sure. I mean, yesterday I was kind of facilitating a bit of a meeting amongst different kind of coalition colleagues that was about tactics, making sure that everybody was kind of getting into the same tactics. And so people disagree on tactics and strategy all the time. And it's kind of an old term, but a diversity of tactics there's nothing wrong with that. You make room for a bunch of different things. There's people who will be, have quite a respectability and a career in lobbying government. As a professional, as a doctor or something like that. And if those people are an ally, I'm happy to make room for them to do that and not sort of trash them publicly, but, meet behind the scenes, and we can diagnose together where the system needs pressure. And then people like me who are more sort of in the street can bring the pressure. And I think lots of social movements have worked that way. And so it's not an innovative model. It's what people have always done to try and get their issues heard.
Right. Awesome. Thanks. Great answer.
Yeah, that was brilliant. I'm actually really, really happy with this interview so far. So I don't know if you had any other things that you wanted to add, Garth?
Nope. It's been really nice to catch up.
Oh, actually, I did have one other thing to add. I wanted to ask you if you were aware of the 25th International Harm Reduction Conference that's happening in Montreal in May.
Yes, I am, and I put in a paper for that, and it didn't get chosen, so I'm not coming.
No.
And if people want to reach you or want to read more about you, Garth, where can they go?
My website is garthmullins.com, and I write a column in a post-media publication every week, and I'm on Twitter at Garth Mullins, so that's probably the best way.
Thanks again for coming to our show, Garth.
All right. And should I say smoke them if you got them, or is that, use that verb? Is it vape them? Vape them if you got them? Okay, there you go. All right. Well, take care and good luck with the podcast.
Thank you.
All right, thanks
Take
a
care,
lot.
Garth.
See ya.
Bye.
Bye.
We hope you enjoyed this episode of State of Vape in Canada. Part 1 of the history of harm reduction in Canada, of course. A lot of parallels with the vaping industry, and we hope that you found some of this information useful as we battle for our rights to vape. To reach us, email us at stateofvapeshow@gmail.com.